We're good to go?
Yes, we are.
Thank you, Madam Administrator. We will now convene the meeting of the Public Health Committee. I am State Representative Jonathan Steinberg from the 136th District and co-chair of this lovely committee. And I'm joined today in person for the first time, no, maybe so, by Senator Anwar, my esteemed co-chair. Good morning, Senator Anwar.
Good morning. Good morning, everyone. Looking forward to an efficient meeting and let the games begin.
Good morning, Representative Pettit.
Good morning, Mr. Chair. No further comments necessary.
I admire you for your brevity, sir. I am looking but do not yet see our Senate ranking members. Unless I'm missing something, I'm sure they will join us shortly. We have 4 items on today's agenda, 4 bills that have heard from the House for this committee's review. I'm getting some feedback. It's everybody make sure they're muted. Oh, I did. I thought I had it. All right, the first item on the agenda is House Bill 5201, an act concerning public health concerns in the acquisition of water companies. This would be referred to this committee by, I'm not sure, and the Environment Committee?
It's from the House. The House referred the bill, but it's an environment bill. It's a
Just want to put some context on it. Thank you, Madam Administrator.
So move.
Okay, do we have a second? All right. He finally got in the so moved. For those of you unfamiliar, the state of Connecticut is virtually unique in terms of the number of water companies we have. We have many, more than 100 water companies in the state, many of which are really small. They're kind of mom and pop operations. And this bill requires the Public Utilities Regulatory Authority, PURA, to consider public health concerns when determining whether a water company, particularly a distressed water system, should be acquired by another entity. These concerns may include, among other things, any closed or active consent decrees or deficiencies that the Department of Public Health identifies. By law, if PURA, in consultation with DPH, determines that the cost to acquire and make improvements to such a water company are necessary and reasonable, it must order the water company to be acquired by the most suitable public or private entity. Existing law requires PURA to consider certain factors in making such a determination, such as whether the acquiring entity has the financial, managerial, and technical resources to reliably and efficiently operate the water company and provide continuous adequate service. This really is a public health bill in many ways, because access to clean, potable, safe water is something that we all expect. And unfortunately, in our state, we have many water companies that don't have the means, the wherewithal necessarily to even make the requisite investments. This committee will recognize that we have another bill before us that we passed out of committee having to do with lead. And we know there are a lot of lead pipes in the state. EPH has been trying for many years to actually accelerate the acquisition of some of these smaller struggling companies, and this clarifying language with those actions. So without further ado, I will turn to Representative D'Amico.
Thank you, Mr. Chair. Just for accuracy, I believe that this bill originated in the Energy and Technology Committee as opposed to the Environment Committee. I will certainly defer to if someone knows otherwise, but I believe that's the case.
You are correct, Representative D'Amico.
Thank you. Just for accuracy, Mr. Chair, I know how you like to be accurate in all things.
Thank you for saying so. Yes, indeed, it came out of Energy, which obviously has jurisdiction with regard to PURA, and that's why this bill is before us. Are there any other conversation or questions? Seeing none, I suppose we could create a consent calendar, or we could just vote on it. Why don't we just vote on it?
Mr. Chair.
Senator Summers, good to see you.
Hello, I'm sorry I'm in the car. I was going to move that we start a consent calendar,
Okay,
but if you want to just vote, that's fine.
or maybe we'll just vote and make it swift.
Okay, thank you.
Madam Administrator.
Representative Steinberg,
Oh,
for
Representative
some reason, I did not hear you, Representative Steinberg.
Senator Steinberg votes yes.
Thank you. Senator Anwar,
Senator Anwar in person votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong, Senator Summers, Representative Pettit,
Representative Pettit votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Dravallo votes yes.
Representative Betts,
Representative Betts votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook, Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott, Representative Foster,
Representative Foster votes yes.
Representative Django,
Representative Jenga votes yes.
Representative Green, Senator Haskell,
Senator Haskell votes yes.
Representative Cavers DeGraw,
Cavros DeGraw votes yes.
Representative Cavers DeGraw, I did not see you on screen, please.
Room. Cavros DeGraw votes yes.
Thank you. Representative Kennedy,
Kennedy votes yes.
Representative Clarides Detrier, Representative Linehan, Representative McCarthy,
Representative McCarty votes yes.
Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan, Representative Scanlon, Representative Tersiak, Representative Young,
Representative Young votes yes.
Representative Zupkis, Senator Wong, Senator Summers,
Senator Summers votes yes.
Representative Cook, Representative Dauphiné, Representative Elliott, Representative Green, Representative Clarides Detrier, Representative Linehan, Representative Ryan, Representative Scanlon, Representative Tersiak, Representative Zupkis. Thank you, Mr. Chair.
Thank you, Madam Administrator. We will be holding the votes open till 11:30 this morning. Many of our colleagues are in transit, particularly since the session today. Moving to item 2 of the agenda, House Bill 5223, an act expanding the professional assistance program for regulated professions to include pharmacists.
So move.
Well, you're fast. Do I have a second?
Second.
Second, I believe I saw Representative Kavaros DeGraw take it by an inch. Oh, there you go. It's getting embarrassing. Okay. This bill adds pharmacists to the list of providers eligible for the Professional Assistance Program for health professionals. Currently, the Health Assistance Intervention Education Network, known as HAVEN. By law, the program is an alternative, voluntary, and confidential rehabilitation program that provides various services to health professionals with a chemical dependency, emotional or behavioral disorder, or physical or mental illness. This is a really wonderful program that the state has, and we would be allowing pharmacists to participate in it. In doing so, the bill makes a number of conforming changes to reflect the fact that it's the Department of Consumer Protection that regulates pharmacists. Currently, the professionals eligible for the program are regulated by DPH. Under the bill, DPH remains the lead agency responsible for the program and also overseeing Haven's annual audit and oversight. The bill also requires Haven to submit its annual report and audit to the General Law Committee. It already does so to the Public Health Committee. It also specifies a number of licensing fees that are increased by at least $5 in the future, that the DCP commissioner must certify the amount of revenue each January, April, July, and October and transfer it to the program. This is particularly helpful that the pharmacists will be added to the Haven program. You may recall that one of the other bills that went through this committee, House Bill 5001, delays some fees, which actually would have a negative impact on Haven. So this, in a sense, restores some of that financial viability. So that's a side benefit. But most importantly, it addresses what just seems like an oversight that pharmacists should have had that opportunity all along. Are there questions or comments? Senator Anwar.
Thank you, Mr. Chair. I just wanted to pretty much repeat what you just said about the fact that Haven program is one of the best in the country, and the fact that the pharmacists were not a part of this is an oversight, and this bill is much needed and very important to try and move forward to make sure that we include pharmacists to be able to benefit from this important program. So I would encourage everybody to vote in favor of this. Thank you.
Thank you, Senator. Any other comments or questions? If not, Madam Administrator, we're ready for a vote. I was going to say Kavaros DeGraw again.
Representative Steinberg.
Representative Steinberg says yes.
Senator Anwar.
Senator Anwar votes yes.
Senator Kushner.
Senator Kushner votes yes.
Representative Gilchrist.
Representative Gilchrist votes yes.
Senator Wong. Senator Summers.
Senator Summers votes yes.
Representative Pettit.
Representative Pettit votes yes.
Representative Arnone.
Representative Arnone votes yes.
Representative Berger Givallo.
Representative Berger Givallo votes yes.
Representative Betts.
Representative Betts votes yes.
Representative Carpino.
Representative Carpino votes yes.
Representative Cook. Representative Dauphiné. Representative D'Amico.
Representative D'Amico votes yes.
Representative Elliott.
Representative Elliott votes yes.
Representative Foster.
Rep Foster votes yes.
Representative Django. Representative Green, Senator Haskell,
Senator Haskell votes yes.
Representative Cavus DeGraw,
Cavros DeGraw votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Clarice Deacher, Representative Linehan, Representative McCarthy,
All right,
Yes.
Representative McCarty votes yes.
Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan, Representative Scanlon, Representative Tersiak, Representative Young,
Representative Young votes yes.
Representative Zupkis,
Okay, I love you very much.
Goodbye.
Senator Wong, Representative Cook, Representative Dauphiné, Representative Django, Representative Green,
Rep,
She's holding her clothes.
Representative Django,
Representative Jenga votes yes. Thank you.
Representative Green, Representative Clarice Deacher, Representative Linehan, Representative Ryan, Representative Scanlon, Representative Tersiak, Representative Zupkis. Thank you, Mr. Chair.
Thank you, Madam Administrator. Once again, we will be holding our votes open until 11:30 this morning. Moving to item 3 on today's agenda, House Bill 5313, an act concerning registration of temporary nursing services agencies and maximum rates for temporary nursing services at nursing home facilities. This comes to us from the Aging Committee. Do I have a motion?
So moved.
Second.
Moved by Senator Summers, seconded by Senator Anwar for a little change. This is another important bill in the sense it's addressing a problem we know exists. Some temporary nursing services agencies have not behaved well. And there needs to be certain requirements in place, which I will explain shortly, to protect the people they serve. These agencies provide temporary nursing services to nursing homes, residential care homes, and hospitals on a per diem or temporary basis. The bill requires the DPH commissioner starting in October to establish an annual registration system for these agencies, which did not exist before, and authorizes the commissioner to charge an annual registration fee of up to $750. Starting next year, prohibits temporary nursing services agencies from providing services in the state unless they have that DPH registration. Requires the DPH commissioner to adopt regulations to establish requirements for these agencies, including minimum nursing personnel qualifications and an annual cost report that the DPH must file annually. Requires the DSS commissioner by January of next year to set maximum rates these agencies may charge a nursing home facility, and requires these agencies starting in 2024 to submit annual cost reports to the DDS commissioner. I will say I've been in consultation with the House Chair of the Asian Committee, Representative Garibay, who assures me that they are responding to many comments from the advocates who have serious issues about the maximum rate setting, and plan to put forth an amendment which would address those caps so that it would no longer be an issue. I know some of us have received emails on this subject, and this might have been a sticking point, but I have confidence in Chair Garibay that she will address this when the bill reaches the floor. Are there comments or questions? Wow, seeing none, I believe we're ready for the vote, Madam Administrator. Administrator. Okay. How about those Mets? Just bear with us momentarily. Madam Administrator, we're ready for the vote.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong, Senator Summers,
Senator Summers votes yes.
Representative Pettit,
Representative Pettit votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Givallo votes yes.
Representative Betts,
Representative Betts votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook, Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott, Representative Foster,
Rep Foster votes yes.
Representative Jenga,
Representative Jenga votes yes.
Representative Green, Senator Haskell,
Senator Haskell votes yes.
Representative Cavros DeGraw,
Gavros DeGraw votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Clarice Dietrich, Representative Lenahan, Representative McCarthy,
Representative McCarty votes yes.
Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan, Representative Scanlon, Representative Tersiak, Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
Senator Wong, Representative Cook, Representative Dauphiné, Representative Elliott, Representative Green, Representative Clarice Dietrich, Representative Lenahan, Representative Ryan, Representative Scanlon, Representative Tersiak. Thank you, Mr. Chair.
Thank you, Madam Administrator. One more time, we will keep the votes open to 11:30, and we now move to the last item on today's agenda. 5357, an act concerning mandatory overtime for nurses in hospitals. This comes to us from the Labor Committee. Do we have a motion?
Second.
Moved by Senator Kushner, seconded by Senator Anwar. This bill generally expands restrictions on the hospital's ability to require nurses to work overtime and applies these restrictions to home health care agencies as well. It places new conditions on how and when overtime can be worked or required and prohibits any retaliation against a nurse who refuses to work overtime. It requires hospitals and home health care agencies to report all mandatory overtime occurrences to DPH and creates a new enforcement mechanism for potential violations. This under current law, the nurses included are registered nurses, licensed practical nurses, and nurses aides. The current law prohibits hospitals from requiring a nurse to work more than a predetermined scheduled work shift, as long as that shift is determined and communicated at least 48 hours before it begins. This bill categorizes this excess work as now overtime, regardless of the shift length, and prohibits hospitals and home health care agencies from requiring nurses to work overtime, with certain exceptions. It also expands the prohibition by additionally categorizing as overtime working more than 12 hours in a 24-hour period, and during the 10-hour period immediately following a previous shift of at least 8 hours. So there has to be a 10-hour downtime, or more than 48 hours in any hospital-defined work week. Okay, I have my own concerns about this bill, but I'll let others speak first. I recognize Senator Kushner, who also happens to be chair of the Labor Committee.
Thank you, Chair Steinberg. This bill came to the Labor Committee, and particularly we heard from a lot of nurses who were really concerned about mandatory overtime. And I want to say at the outset that there are many hospitals here in Connecticut that do not require mandatory overtime. So this, again, is a bill that really is designed to really address any outliers. I think during the pandemic, we all know nurses were on the front line and very stressed out and very suffered a great deal of PTSI. And a lot of that really was unavoidable, and they recognized that. But it did heighten the awareness and need to address any mandatory overtime and the stresses that it puts not just on the nurses, but also it concerns us about patient care. I do want to say at the outset that we have heard from the hospitals and the Hospital Association that there are concerns about this bill. We've heard from some nurses that there are concerns about this bill. And I have been in touch with the proponents, with the advocates that have worked on it, and have been assured that they are willing to work on a compromise that would address some of the concerns that have been raised. I would urge people to vote this out of committee today as a work in process, that we can continue to address some of the concerns, but also make sure that we are really accepting from the nurses who advocated for this the importance of addressing further addressing the issue of overtime. And so, I would urge my colleagues to vote yes on this, and happy to answer any questions that people might have. Thank you.
Thank you, Senator. And I think we should all hear loud and clear what the senator just offered, is that this bill is not finished and would need some significant changes before it would be brought to the floor in the House. Next up is Senator Anwar, followed by Representative Pettit.
Thank you so much, Mr. Chair. I just wanted to give a little bit of a background. As I understand it now, in my other life, I am intensivist and take care of patients in the hospital, in the ICU. And right now in the pandemic, we have recognized that there have been significant staffing issues, and those issues are going to unfortunately increase. In order to solve those immediate needs, the solutions may actually result in exacerbating the problem, and that this bill starts to address some of those. And I also wanted to share that there's going to be safety issues around patient care that are critical as well. We made a list of all the high-risk professions in the United States, and nursing is one of the highest risk professions in the country, because you will come across nursing staff that actually have chronic injuries, back injuries that they would get because of the workload itself, but also, of course, managing some of the patients and the emotional trauma that the nurses have to endure between the physical, emotional abuse in some situations with difficult patients. So a combination of all of these is a significant stress on the nursing profession. And now the ratios, because of the reduction in the number of nurses and some patient population increases, is exacerbating that further. So a nurse in a regular unit may have 8, 9 patients at times in some situations. And for them to be able to make sure that all of those patients are getting their medicines in a timely fashion, the risk of errors starts to increase as the number of patients increase and the number of hours they're working increases. In the intensive care unit, if they're seeing more than two patients in the ICU, the risk, emotional trauma to the nurses increases, but also the trauma or impact on the patients from errors is there. If somebody is working for 16 hours taking care of human life, the risk is going to be much higher. What this bill is trying to address is that there are nurses who do have the bandwidth or the requirement or the capacity to be able to do it, but if they are mandated to do it, that becomes challenging because not everybody has that capacity because they may have different situation in their homes. So having the voluntary opportunity is still there in this bill, but the mandatory opportunity is getting restricted, which actually has a protection. And I know the hospitals who have a prime responsibility to take care of their patients would love to have less restrictions so that they can perform the services. But in this situation, if we continue on the current path, more and more nurses are going to move out of our state. And this problem that we are trying to fix is going to actually become much worse what the hospitals would want. So I think this push and pull and this stress that we are discussing will get better if we try to protect the nursing staff and identify ways of getting more nursing to our state, which is again part of the agenda that we have as a committee that we will be working on and will continue to work on as well. But I do feel that this bill has a lot of positive things. Some of the adjustments can be performed later, and I would make sure that people consider voting this out, and some of the tweaking that is needed in collaboration with Connecticut hospitals and Connecticut Hospital Association can be performed later. So I just wanted to put that in perspective, and thank you, Mr. Chair, for the opportunity.
Thank you, Senator. Though I would state that it is arguable whether this would be beneficial to our workforce issue with nurses. And hopefully an amended version of this bill would make it clear and give me greater confidence in our nursing shortage in the state. Representative Pettit, followed by Senator Summers.
Thank you, Mr. Chair. I would respectfully disagree with some of the previous comments from the co-chair and use the example of hospitals take care of our sickest patients, and we have people that are highly trained both at the clinical and administrative levels. In this specific instance, there's vice president for nursing, there's nursing leaders in subspecialty, there's nursing leaders on floors that have responsibility for the care of the patients. And they know, they have forgotten, you use the old expression, they have forgotten more than we will ever know as a legislator about how to manage running a hospital day to day. I just don't, from broad philosophical strokes, I don't think it makes sense for the legislator to micromanage the day-to-day operations of a hospital. I think our co-chair might not be happy if the legislature was trying to reach in and micromanage how he staffed and ran an intensive care unit. The hospitals do their best to staff appropriately. They get people that volunteer, they use pool nurses, they use traveling nurses, which has benefited traveling nurses to the tune of an average salary in the US last year of $177,000. And sometimes those very nursing vice presidents, nurse managers go from administrators to back to nursing when they are needed. I think this allows hospitals to make appropriate decisions hour to hour, shift to shift, given the patient load and severity of the patients that are present. And it really makes much more sense for this to be managed on a local level. I don't think a bill attempting to chase after, I always hear it all the time. We're always after the bad actors. And it's the people who follow the rules who end up paying the price, regardless of the statute you're talking about. I think the flexibility is critical. When I met my wife in Pittsburgh, she was ecstatic when they went to a 3-4 system where she could work 3 days and have 4 off, work 4 days and have 3 off, and was happy to work extra hours to be able to have full days off. And not everybody can do it. So some of the nurses did and some did not. It allows the hospitals the flexibility to offer that to staff that are ability to adjust their services. This has been before us in the past. We have a statute 19A 490 on current mandatory overtime, and very few are using it. I don't, and I would agree with the chair's comments in that I don't think that this will help retention and attracting people, because it takes away flexibility in scheduling. In addition, there's sort of complex reporting and certification requirements in this bill that I don't think is necessary for hospitals to do, when really their focus should be good patient care. And also, as you read the review, Mr. Chair, the provision allows nurses to bring legal action, and instead of being regulatory and having enforcement from the Department of Public Health. So I think it goes far beyond what is necessary. I think we need to continue to depend upon our hospital leaders, the physicians, the nurses, to make appropriate decisions. I think, in the years when I worked in New Haven, New Britain, Bristol, when someone was overtired, they were told, you're overtired. You need to go home. You need to take some time off. Whether it was a nurse, whether it was a physician, whether it was a technician, people look after one another. And I don't think managing this from a statutory basis from a state level is appropriate. And I think it will have a negative impact on the industry beyond what perhaps, and I understand that there's some concerns, but I think those can be addressed in other fashion. And finally, philosophically, it's only my 6th year here, but rarely do I see things that the work in progress get fixed. I think that's a bad policy. I think that's what committees are for. I think that's what off sessions are for. I think complex issues should be fixed before they get to the floor of the House and the Senate at 10 o'clock on a Thursday night, when most of the people don't understand the details of the bill. So I think that's generally a bad philosophical approach, a bad practical approach. And I think it's a bad approach here to attempt to fix it on the fly later on. So for those reasons, I'll be voting against this bill. If it's a work in progress, I think they need to go back to the drawing board and come back next year with a bill that makes a little more sense and it doesn't have a negative impact on the industry. Thank you, Mr. Chair.
Thank you for those comments, Representative. Though I'm sure you meant to exempt all public health bills that are a work in process. They always come out as Senator Summers, followed by Representative Foster.
Yes, I would like to align my comments with Representative Pettit. I don't want to repeat everything that he said, but I do believe, and I think the chair has hinted at this, that this bill will actually have an adverse effect on the amount of patients that can be cared for in our hospital systems. I would like to ask if this bill will also apply to our Connecticut hospitals, i.e. Whiting Forensic Hospital. If this bill is going to apply there, or are they carved out? And secondly, I have heard overwhelmingly from nurses actually working in the field, not the union representatives, but the nurses themselves, that they do not support this bill. They want the flexibility. They want to be able to work the hours they want, and that they are not mandated to work overtime unless it's an emergency, which is in our current statutes. So I'd also like to find out what hospitals are actually mandating, meaning if you don't work this, you lose your job. Can we have a list of those hospitals? And does this apply to Whiting Forensic?
Thank you, Senator. I do not have a precise answer for you with regard to Whiting. I will try to get that. It is a hospital and you think it would apply to them, but I will get you that answer, hopefully before we have a vote. And in terms of the hospitals which are currently requiring mandatory overtime, I understand there really aren't that many, but I don't have those specifics for you. Perhaps we'll be able to get that.
So I would like to just respond to that. The mandatory overtime issues that I have heard are coming from our state hospitals, so to speak, whiting forensic with the mandatory overtime. Our other hospitals, they do not have mandatory overtime unless there's an absolute emergency. Many of the nurses I've spoken to have worked on the floors to pick up extra shifts because they're making $200 an hour and loving it, and they do not support this bill. There may be tweaks that are required to make this more palatable, but again, having a nurse be able to bring a lawsuit against a hospital, I think this goes way beyond what the legislature should be meddling in, quite frankly, between an employer and an employee. I think there are protections in place, and I will be voting no on this bill today to flag it. We will see what the changes are that can be made, and to see if we can get agreement with the hospitals and the actual nurses that are doing the work before this bill comes to a vote on the floor. But I will be a no today to flag it. Thank you, Mr. Chair.
Thank you, Senator. And I have to admit, I share your concern about the lawsuit provision. Representative Foster, followed by Representative Kennedy.
Thank you, Mr. Chair, for allowing me the opportunity to speak. I was, after speaking to the Connecticut Hospital Association, Hartford Hospital staff yesterday, I reached out to some nurses in my district who work and have been enjoying and taking large advantage of overtime during this pandemic. And I want to align myself with those concerns that have been shared by Representative Steinberg and Representative Pettit. I am concerned. I have a lot of confidence in Senator Kushner's ability to find resolution in the particular provisions that are concerning. But I do find that for the nurses that work specifically in my district, who I was able to talk to in a short notice, that they find that this would hurt them because they are only voluntarily taking overtime now. And so if they don't want to come back, they won't. And this would negatively impact their ability to do the extra shifts that they'd like to. And I am concerned, the small community hospitals that serve the majority of folks in my district are really having a hard time. They have been having a really hard time staffing nurses anyways, because they're paying travel nurses higher rates than they were paying people in general in the area. And I am worried that that'll shift that labor pool. This might shift that labor pool worse and make it even harder for our small community hospitals, who I hear inklings anyways that might be dwindling, that those will be negatively impacted. So as a community that feels underserved at times, I hope that we can find a way for this bill, if it gets to the floor, to protect communities that are served by understaffed community hospitals right now, and also make sure that the nurses are given the opportunity. I feel very torn on voting this bill out of committee, but I do have a lot of confidence in the good senators' willingness to negotiate. But I feel apprehensive because it does feel like it's not aligned in the nursing perspectives that we heard and seen in this testimony. Seem significantly different than every nurse that I spoke to coming in. So that gives me great pause. So I'm grateful for the opportunity to voice my concerns about this bill, and I look forward to seeing improvements, hopefully before it hits the floor.
Thank you, Representative. And to answer Senator Summers' question, we have verified this would apply to whiting as well. Representative Kennedy, followed by Senator Anwar for the second time.
Thank you, Mr. Chairman. You know, during the pandemic, we applauded our nurses. Our nurses are remarkable. They're the most wonderful things, I think. I know many people that are nurses, but this bill goes beyond. We are always talking about the need to attract more nurses and to get nurses in the field, that there is a nursing shortage. What we learned during the pandemic is we need our nurses more than anything. And I believe that this bill is just, it's not right. It's not time. I agree with the remarks of Representative Foster that I do believe that perhaps the work will get done, but we are so close to the end of session that pushing this out of committee, a work in progress, is just too quick. I also want to note that one of the biggest things of nursing, this bill will limit the ability of nurses to voluntarily work the schedules and the hours that they set, and to have the proper care for their patients. One of the one of the good things about nursing is they work their own schedule. They figure that out and it works to their ability. The other, as it's been stated before, and I need to reinforce it, this bill can result in potential legal action, and that concerns me. And one of the things that hasn't been stated, because I'm not going to go out everyone else said, I spoke with Yale New Haven Hospital, and on March 31st, they announced a partnership with the local universities. And those universities are Fairfield University, Quinnipiac University, Southern Connecticut State University, and Gateway College, all wonderful programs, all wonderful universities with nursing programs. This partnership will give nursing candidates that become enrolled also the potential to be employed by our hospitals all over New Haven and throughout over the course of about a 4-year program. In addition, one of the most important things is that their partnership will give $1.7 million to students that might not have the opportunity to attend nursing school. And it will also offer scholarships and books. And we all know how much books cost in college. So, and Yale is very committed to this. And for that and other reasons that have been stated today, I think the biggest thing we want to do is we want to attract and retain our nurses. And I don't believe that this bill does that. So today I will be a no. Thank you, Mr. Chairman.
Thank you, Representative. Senator Anwar, followed by Representative Betts.
Thank you, Mr. Chair. Through you, Mr. Chair, is it okay if I ask some clarifying questions of the Honorable Chair of the Labor Committee, who actually is in this committee as well?
Please proceed.
Senator Kushner, I wanted to clarify, in my reading of the bill, it does not take away the nurse's right to make a decision about their shifts. Is that accurate?
Senator Kushner.
That is accurate. This bill still provides for voluntary overtime. I think that the concern that I've heard from some members is about the prohibition on the amount of time you must rest between overtime shifts, 16-hour shift, and your next shift. And I do think that is the area that I've heard the most concern from nurses about. I have heard nurses support the rest of the bill, but that's their issue. And I think in that regard, the advocates are willing to discuss changing that provision and accommodating, working with the hospital association and hospitals and the nurses to address that concern.
Senator Anwar.
Thank you, Mr. Chair. Thank you for that answer. So I know some of my colleagues are saying that this is a anti-nursing bill. And if the nurse still has a choice, not necessarily required to work for 16 hours, everybody has different circumstances in their job, in their life. And if somebody is required by their employer to do extra shift, does that make it a pro-nurse bill? Because the bill to me makes sense that it's helping the nurses to make a choice how much they want to work. And some of the conversation that I heard was that it's going to actually cause more harm to the nursing. Can you help me understand that a little better, please?
Senator Kushner.
I have heard about from nurses directly, particularly in my community, great concern about mandatory overtime. And clearly, these nurses were impacted by the pandemic. They were very, very stressed out, some of them suffering from PTSD as a result of the overtime in that emergency situation. And they were not critical of the fact that they had to address the situation. They were critical of the hospital for not having enough staff. And I think we've all heard that staffing is an issue. There are several hospitals in Connecticut that do require mandatory overtime. I am told that both UConn and Wyndham Hospital are now requiring mandatory overtime. And there may be a third I'm trying to confirm. But these are significant hospitals. So that is a concern as well.
Senator Alwar.
Thank you so much. I think that clarifies the question because there is a little bit of a confusion in the conversation earlier. In my mind, if a nurse has a choice, he or she would want to work for 16 hours or 12 hours or 8 hours. They have that choice, and this bill does not restrict them in any shape or form. So anybody to suggest that this bill is taking the nurses' right away may not be fully accurate. The only part of the bill that is suggesting is that after 16 hours, they should get a 10-hour break. And if I was the patient, and if my family was a patient, I would want that nurse to get some rest, because if they make a mistake of giving a medicine because for the 16 hours they've had no break at all, because they are taking care of 8 patients and then they're running around nonstop, I would want them to get some rest. But that's going to be negotiated in whatever way you want. But the bill is about the hospitals on one side and the nurses requiring to do extra shifts by the hospital on the other side. And there's so you can just say that you are supporting the hospital. That's fair, but I think saying that you're supporting the nurses by voting this bill down may not be fully accurate. At least that's how I see it, and that's how I heard from the nurses that I interacted with. So thank you, Mr. Chair, for that opportunity.
Thank you, Senator. Representative Betts, followed by Representative Miko, followed by Representative Zupkis.
Thank you, Mr. Chair. I have a number of questions, if I may, through you to the proponent. The first one is dealing with, does this type of proposal that we're considering today, does this exist anywhere else in the country? And if so, what has been the record in terms of retaining or keeping nurses?
Senator Kushner.
I'm sorry, Representative Betts, but I do not know the answer to that. I can try and find out.
Okay, thank you. Well, I do think that that's an important consideration, because even though it may be designed for good purposes, we have no evidence that that is in fact what's going to happen. With respect to UConn, I think I heard previously, but if the senator could just confirm, does this impact UConn Health Hospital? And if so, what would be the financial implications to our state university hospital if this were to be passed?
Senator Kushner.
My understanding is that it does have an impact on UConn Health because they are using mandatory overtime with some frequency when voluntary overtime is insufficient to meet their staffing needs.
Representative Betts.
Thank you for that answer. And another one is pertaining nationally to what I think is probably one of the most controversial parts of this bill. Are there any hospitals or are there any organizations associated working with hospitals that give the nurses the right to conduct legal action against their employer, their hospital?
Senator Kushner.
I believe that there would be many different steps one could take in hospitals to take legal action. So I'm sorry, I think it might be a little too broad for me to be able to answer that, but I'm certain there are other, in our state and in other states, the ability to take legal action. I think there are currently certain rights to take legal action, even in Connecticut here already. And it's my understanding that that is one of the issues that has been raised about whether or not, in fact, nurses already have some of these rights.
Representative Betts.
Thank you very much, Senator. I represent a local community hospital that's been managed pretty efficiently and is very strongly supported by the community because we do, excuse me, get very good care for patients. We also know for a fact that there are several small community hospitals that are hanging on by a thread. And if this were to pass, would this not, in fact, put increased pressure on them to either close or seek a partner out because of this new financial obligation?
Senator Kushner.
I think that there are concerns about the closure of small hospitals in our communities. Unfortunately, I think much of that is already happening around much larger issues than mandatory overtime for nurses. I think these are issues that we've been confronting in Connecticut and around the country in terms of the way healthcare is delivered in our country. To your question earlier about other states, I did get information that Washington, Massachusetts, and California have strong mandatory overtime language. 18 states in all have much stronger language than we have here in Connecticut. And also to an earlier question, I want to make sure people know that I just learned that Bacchus Hospital also requires mandatory overtime.
Representative Betts.
Thank you very much. Thank you very much for that. It really astounds me how we as legislators engage or adopt policies that impact employers and employees, and yet we lack the expertise, the experience, and the background of what we're trying to do. I think the message that this bill would pass, if this bill passed, would be very clear, particularly on small community hospitals. And there is little doubt in my mind that they would have a very difficult time meeting these requirements. And as somebody who really is a vigorous, strong supporter of community hospitals, I don't want them to close shop or be taken over because of something what the legislature forced them to do, knowing they don't have the financial resources and knowing we don't have any experience or significant evidence of this working to make the whole system work. Not just the nurses, but what about the patients? What about the staff? What about the community? And small community hospitals are clearly a centerpiece of many, many communities. And this clearly, in my judgment, is very harmful to the hospital. And frankly, where are nurses going to get jobs if the hospital is closed? I just cannot support this either in an intent or with the idea of the legislature trying to pass something for which I believe we have very limited expertise. And certainly you have to give financial consideration and impact on places like UConn. And where's the state going to get the money to give them more money to be able to pay for this unfunded mandate? So that I am a very strong no, and I'm really concerned if the committee moves this out with so many questions. I'm not sure that that's something we can explain because it's a short session. They're complex questions. And frankly, I think a lot of people would be right to, ask us, how can you pass something like this with so many real concerns and questions raised? We have no business, in my opinion, doing it this year, and I'll definitely be voting no. Thank you very much, Mr. Speaker, or Mr. Chairman.
Don't do that to me, Representative. Representative Miko, followed by Representative Zupkis, followed by Representative Pettit for the second time.
Thank you very much, Mr. Chair. I just wanted to go back to some comments that were made earlier in the debate on this bill this morning. So it was suggested that there was much testimony submitted on this bill in the Labor Committee, much testimony submitted from representatives of unions, and that I find that to be true. In looking through the testimony, there was a significant amount of testimony from unions. However, I don't see that we should discount that testimony. As a matter of fact, we should probably give it quite a bit of credence because the people who submitted that testimony represent a significant number of nurses, frontline people, people rank and file nurses, and I don't think that it would be legitimate to discount that testimony. And I believe it was also suggested that there was little to no testimony from individual frontline rank and file nurses. I did not find that to be the case. I'm looking through the testimony that was submitted to the Labor Committee on this bill, and there are several pieces of testimony from rank and file nurses attesting to the negative effects that mandatory overtime has on them and their families, and on the quality of the service that they're able to provide. So I think just for the sake of accuracy, Mr. Chair, I just wanted to clear that up. Thank you very much.
Thank you, Representative. We're all in favor of accuracy. Representative Zupkis, followed by Representative Pettit.
Thank you, Mr. Chair. And just a question, the fiscal note says significant. What is significant? What are we talking here? Through you, Mr. Chair.
That sounds like a very philosophical question. Would you like me to address that to Senator Kushner, perhaps? If she chooses to answer.
I don't think I can give any, I think we've seen fiscal notes like this on many occasions, and I don't think that we're in a position to get OFA to nail that down. They give us their best language that they use in all of their fiscal notes for a lot of our bills. Thank you.
Representative Zupkis.
Thank you for that answer. Well, significant to me means very burdensome and a lot. So that is a concern. And I guess my last is just a comment. As I've listened to people talking, it seems people have some questions, a lot of questions about this bill and want some changes done after it gets out of committee. Well, this is the second committee it's been in, and I don't know that there have been any changes from the Labor Committee to here. Maybe there have, and I don't know that. So now we're in the second committee and it still needs work. So why would we not fix it now before it gets out of committee? Through you, Mr. Chair, or to you, Mr. Chair.
I will give this a shot, and if Senator Kushner wishes to comment as well, I'll afford her the opportunity. It is not unusual for a bill to be referred to other committees of cognizance. And given that it is a short session, this all has to happen on a pretty tight timetable. So I think that the Labor Committee chairs are very much aware of the pushback, which is what has led to some of the conversations in recent days about changes. I would argue this is a function of the particular calendar and environment we're dealing with and does not reflect any sort of unusual activity. Senator Kushner, anything you'd add?
Yeah, I would just add that I find that there are a number of bills that are brewing around the legislature that are still in lots of discussions about how to bring parties together to pass good policy in Connecticut. And this is just one of them. I do think that there will be a significant effort to reach that goal. And I think the parties are all aware that if there isn't significant effort, it will never see the light of day. And I think that's a real motivating force. And I just have one other comment, which is, you know, I hear the concern about UConn Health, but I feel like this is one of those issues, and Senator Anwar spoke to this at the outset, that mandatory overtime is a huge problem. And it not only puts families into turmoil, but it puts patients at risk. And so, you know, I think that's something we have to take into consideration. You know, clearly everyone will be looking to bring this bill to a position where we can support it and have strong support for it. But I would like to see us get it out of committee today so we can continue working on it. Thank you, Mr. Chair.
Thank you, Senator. Representative Zupkis?
Thank you for that. I do understand in even long or short session, I see it happening often that things come through the committee and it's passed out and worked on later. So understanding the time frame in a short session, I see it in both sessions. And I do understand the reasoning on why bills have to go to different committees. I just have also seen that things pass and never get fixed. And so I'm hopeful that I will be proved wrong with this bill. For that reason and the other reasons mentioned, I will be a no. Hopefully it gets fixed and we could be a yes. But I just, going through two committees and it still needs work is concerning to me. Thank you.
Thank you, Representative. Representative Pettit for the second time, followed by Representative Kavros-DeGraw.
Thank you, Mr. Chair. I was going to speak to the OFA, the fiscal note, and Representative Zupkis has done that. But however, we brought up the concept of this involving Whiting and Dutcher, so I assume we'll have to go back to OFA for another fiscal note on, since Whiting and Dutcher is a very subspecialized area of nursing care and what the fiscal impact will be on those facilities if they are indeed included. Second would be a question as to some of the testimony, whether or not home health care agencies are included in the provisions or whether that's one of the points that is attempted being taken out in the future, Mr. Chair.
Thank you for the question, Representative. I'm going to defer to Senator Kushner. Maybe she can give you a definitive answer on home health care agencies.
Thank you, Mr. Chair. I do believe that's one of the areas that will be addressed through a compromise.
Representative Pettit?
Thank you for that. And secondly, as I understand it, and I may not have it correct, I think some of the mandated overtime, specifically at a place like UConn, is part of negotiated contracts. Is that not correct, Mr. Chair?
Senator Kushner?
It is a mandatory subject of collective bargaining.
So in other words, the unionized nurses there have agreed to some mandatory overtime. Or am I misunderstanding the concept?
Senator Kushner?
I'm not familiar with their negotiations, so I can't speak to what they've done in collective bargaining. And I only know that as a subject of that it is a subject of bargaining, but I don't know the history there.
Representative Pettit?
And again, willing to be corrected. I think staff is often offered a higher rate of pay if they volunteer rather than mandated. So I think those are two important issues, whether the rates of pay vary, whether you're a volunteer, whether it's mandated, and if it actually is an agreement in the places that have mandated overtime that they've agreed to it in their collective bargaining agreement. Thank you, Mr. Chair.
Thank you, Representative. Representative Cabros DeGraw, followed by Representative Berger Travallo. Well, I didn't get confused since you both want to speak. Okay.
I admit my hand was up first. Thank you, Mr. Chair. I appreciate it. I have concerns as well. However, just sitting here doing, some research as we're talking, because there were some questions that I was a little curious about. It is interesting to note that our surrounding states, they have it's illegal in a lot of cases. Like for instance, in New Jersey, it's illegal in hospitals and nursing homes to have mandatory overtime. So I think if we're looking at our surrounding states and what's going on there, I don't think we're going to be an outlier with this. I do understand the concerns over short session. I have those as well. But I also think that that's how we move legislation forward, is that we say, okay, we're going to do what we can with our public hearings. We move it out of committee. We continue to work on it. I have every confidence in the chairs that they will continue to do that. I know there is concern over the number of rest hours. And I'm thinking about what it has been like and trying to put myself in the shoes of these nurses that have, and doctors who have just lived through an unbelievably an extraordinary, unprecedented 2.5 years, and what the PTSI must look like around that. And the amount of rest that they, I'm sure, are not getting because they're either choosing to work mandatory overtime or they need to work mandatory overtime. But I do think about in terms of those mistakes. And if they were an airline pilot or even a flight attendant, they would be required to have a certain number of rest hours by, again, the government, in order to not end up with accidents or errors that could result in the loss of many lives. And I think that that's not a dissimilar analogy to make to this situation. So for me, I am going to be a yes today because I do think that this is headed in the right direction. I hope that the concerns are addressed, and I believe they will be, but I think it is the right direction for us to be moving into. Thank you so much, Mr. Chair.
Thank you, Representative. Representative Berger Travallo.
Thank you, Mr. Chair. Reps D'Amico and Cabros DeGraw actually spoke to most of what I wanted to say. So thank you to my doppelganger. It was said that this is going through 2 committees. I heard that from one of my colleagues. I wouldn't say that that's entirely accurate, that this has gone through 2 committees. This is basically just sort of running through the room that the committee is sitting in right now. But with the understanding of the time limitations and the knowledge that it will be my responsibility to track changes, I do look forward to seeing the next incarnation, and I have the utmost confidence in the labor chair to address the concerns that we've all shared, and I will be voting yes.
Thank you, Representative. I will just state that if this bill were to reach the floor of the House in its current form, I would be a hard no. And my initial inclination was to be a hard no today. I'm very concerned about the workforce here in the state of Connecticut, which is not unique. It's true all over the country, where there's a shortage of critical healthcare professionals, and nurses are front and center in that. And I'm very concerned that this bill may actually have an unintended deleterious effect on our ability to recruit and retain nurses here in the state. And as others have said, it's critical for us to acknowledge the amazing job that they did during the pandemic, particularly during the early part of the pandemic, not only working long hours, dealing with strenuous conditions and heart-wrenching circumstances with people that they did everything they could to save, and many people died anyway. The effect on their mental health, I can only imagine. and we owe them a debt of gratitude. And we should do everything possible to consider ways in which we can protect them and protect the patients that they take care of. And I'd like to believe the intent of this bill is consistent with that goal. If we do not see significant changes, and I believe there is a path to compromise, maybe a tenuous path, maybe not a very likely path, but if those compromises are not struck, I will not only vote no on the floor of the House, I will advocate against the bill. So this puts tremendous onus and responsibility on the chairs of the Labor Committee, and it's only because of my trust and confidence in the chairs to get it right that I will flag this bill, but I will flag it and vote in favor of it. You can do that, you know. It doesn't always have to be negative. Suffice it to say, this is a bill that if it remains controversial, is very unlikely to get called before the legislature in a short session. I don't know if that's any reassurance for folks, but I'm relying on that to a large degree. So I would encourage my colleagues to give it a chance as a working process. I guess the difference between chairs and ranking members is chairs like working process more than rankings do. We think we can get it right. Maybe hope springs eternal. So I'm going to suggest that on behalf of all members, and seeing no further comments or questions, I believe we're ready for the vote, Madam Administrator.
Representative Steinberg? I did not hear you, Representative Steinberg.
That's because my button was not. Representative Steinberg votes yes.
Thank you. Senator Anwar?
Senator Anwar votes yes.
Senator Kushner?
Senator Kushner votes yes.
Representative Gilchrist?
Representative Gilchrist votes yes.
Senator Wong? Senator Summers? Representative Pettit?
Representative Pettit votes no.
Representative Arnone?
Representative Arnone votes yes.
Representative Berger-Givallo?
Representative Berger-Givallo votes yes.
Representative Betts?
Representative Betts votes no.
Representative Carpino? Representative Cook?
Representative Cook votes yes, with hoping for fixes.
Representative Dauphiné? Representative D'Amico?
Representative D'Amico votes yes.
Representative Elliott? Representative Foster?
Rep. Foster votes yes.
Representative Django?
Representative Jenga votes yes.
Representative Green? Senator Haskell? Representative Cavros-DeGraw?
Cavros-DeGraw votes yes.
Representative Kennedy?
Kennedy votes no.
Representative Clarides Deacher? Representative Linehan? Representative McCarthy?
Representative McCarty votes no.
Senator Moore?
Senator Moore votes yes.
Representative Parker?
Representative Parker votes yes.
Representative Ryan? Representative Scanlon? Representative Tersiak? Representative Young?
Representative Young concurs with the chairman of the public health and will vote yes, but flag it.
Representative Zupkis?
Representative Zupkis votes no.
Senator Wong? Representative Carpino? Representative Dauphiné, Representative Elliott, Representative Green, Senator Haskell,
Senator Haskell votes yes.
Representative Clarice Detrier, Representative Linehan, Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon, Representative Tersiak. Thank you, Mr. Chair.
Thank you, Madam Administrator. Once again, the votes will be held open for a little under an hour until 11:30 today. I encourage all of our colleagues to make sure they register their votes. This concludes the items for discussion and vote today. Without further ado, I will declare this committee in recess. Thank you.
Madam Administrator, may I vote, please? Do I have to stand? Madam Administrator, may I please cast my votes?
Yes, please.
Okay, I'm ready.
Item number 1 on the agenda, House Bill 5202. How would you like to vote?
Representative Zupkus votes yes.
Item number 2 on the agenda, House Bill 5223.
Representative Zupkus votes yes.
And I have you voting on the other 2 bills. Thank you.
Thank you.
Representative Cook, are you there?
Hi, Bev.
Hi. Item number 1 on the agenda, how would you like to vote? House Bill 5201.
Cook votes yes.
Item number 2, House Bill 5223.
Cook votes yes.
Item number 3, House Bill 5313.
Cook votes yes.
Thank you, and I have you on the 4th bill, so you're all set. Thank you.
Have a great day.
Thank you, bye. Representative Ryan?
Yes. How are you?
I'm fine, thank you. Item number 1 on the agenda. House
Representative
Bill
Ryan votes yes.
Item number 2 on the agenda, 5223.
Representative Ryan votes yes.
Item number 3 on the agenda, House Bill 5313.
Representative Ryan votes yes.
And I have you on the 4th bill, so you're all set. Thank you.
Thank you.
Representative Clarice Detrier.
Senator Summers, how are you?
Hi, I'm well. I have to vote on the last bill.
Yep. Got it right here as soon as you're ready.
Heather Summers votes no.
All right, you're all set.
Thank you. Do you mind helping? I don't know what I have in there, but it's so freaking heavy.
Hello, can I vote, please? Cast my votes.
Yes, we can go right
Hold
ahead.
on, can't hear you. Okay,
There we
okay, sorry.
So we've got HB 5201, an act concerning public health concerns in the acquisition of water companies.
That's the first one, correct?
Yep.
Yes. Claire
Okay.
DeSteger votes yes.
Item number 2 is HB 5223, which is an act expanding the professional assistance program for regulated professionals to include pharmacists.
Claire DeSteger votes yes.
All right. Item number
There's four bills.
3
There's four
is-
bills in total, right?
Yes.
Okay, this is the third. Okay, thank you.
Yeah, item number 3 is HB 5313, an act concerning registration of temporary nursing services agencies and maximum rates for temporary nursing services and facilities.
Yes, yes.
Okay. And item number 4 is HB 5357, an act concerning mandatory overtime for in hospitals.
No.
All right, you're all set.
Thank you. Have a great day.
You as well.
Bye.
Hi, Representative Daphne. How are you?
I'm great. How are you? I'm sorry. I'm driving and I have had the worst time getting in on this meeting. I was on and off, on and off. I wished I could have heard a little more of the debate, but I had to take a side road because there was an accident. It's just been nuts this morning, but I do need to vote.
Yes, so we've got, I believe, 4 bills for you.
Yes.
So first is HB 5201, an act concerning public health concerns in the acquisition of water companies.
Yeah, I'm a no on that.
Okay. Item number 2 is HB 5223, an act expanding the professional assistance program to regulate professions to include pharmacists.
I'm a yes. Is that everybody was a yes on that?
So far, yes.
Yeah, okay.
HB 5313 is item number 3. That's an act concerning registration of temporary nursing services agencies and maximum rates for temporary nursing services at nursing home facilities.
Can you repeat what that was again?
An act concerning registration of temporary nursing services agencies and maximum rates for temporary nursing services at nursing home facilities. That's HB
Okay.
13.
And was everybody a yes on that?
So far, yes.
Okay, Rep. Daphne is a yes.
All right. And item number 4 is HB 5357, an act concerning mandatory overtime for nurses in hospitals.
Yeah, Rep. Daphne is a no.
All right, then you're all set. That's all of our
Thank
bills.
you. Thank you so much. You have a great day.
You as well.
Hello, can you hear me from the hallway?
Yes, hi, Rep. Carpina. How are you doing?
Good. I think I just have the final bill to vote on, but please
I
check.
believe that is correct. Checking right now. And yep, just HB 5357, which is an act concerning mandatory overtime for nurses in hospitals.
Thank you. I would like to vote no.
All right, you're all set.
Thank you for following up.
Okay, have a great day.
Bye-bye.
Hey Dallas, can I also vote as well?
Yes, you can. So we've got 4 bills for you, if I'm not mistaken. Yes.
Yes.
So just pull them up right here. We've got HB 5201, an act concerning public health concerns in the acquisition of water companies.
I'm a yes on that one.
All right. HB 5223, an act expanding the professional assistance program for regulated professions to include pharmacists.
Yes on that one as well.
Okay. HB 5313, an act concerning registration of temporary nursing services agencies and maximum rates for temporary nursing services at nursing home facilities.
Yes, as well.
All right. And HB 5357, an act concerning mandatory overtime for nurses in hospitals.
I'm a no on that one.
All right, you're all set.
Thank you. Take care.
You too.
Hey there.
Hi, Representative Terziak. How are you?
Oh, I'm just fine. So we had 5 bills today.
Just 4. So,
Was the last one held?
no, none of them were held.
Oh, okay. My confusion then. Can I just say that I'm a yes vote for all of them, or do you want to do it one at a
I'll just
time?
read through them just to make sure you know. Is
Very
HB
good.
5201, HB 5223, HB 5313, and HB 5357.
Thank you very much. This is Representative Terziak voting yes on each of them.
All right, that sounds great.
Great. Thank you very much. I appreciate it. Okay.
Great,
Bye-bye.
enjoy your day. Senator Long, how are you?
I'm good, Dallas. How are you?
I am very well. So we got, I believe, 4 bills for you here. Yep.
Yes.
So if you're ready, and we can. Yep. So HB 5201 is item number 1, an act concerning public health concerns in the acquisition of water companies.
I am a yay.
Gotcha. I will need you to turn on your camera for this. So.
Hold on a second. I thought I had the camera on. I do have the camera on.
There we go.
Can you see me?
Good now. Yep.
Okay.
All right.
It's a yay.
A yay for the first one. Second is HB 5223, an act expanding the professional assistance program for regulated professions to include pharmacists. And I'll just let you know your camera turned off again.
Okay, no worries. That's it. That's a yay.
Oh, there we go. Okay. And item number 3 is HB 5313, an act concerning registration for temporary nursing services agencies and maximum rates for temporary nursing services at nursing home facilities. Just so you know, your camera did turn off once again.
That's okay. It is 5313, correct?
Yep.
I am a yay.
All right. Item number 4 is HB 5357, an act concerning mandatory overtime for nurses in hospitals.
I am a no.
All right, we're all set.
Thank you, Dallas. And again, it's an opportunity for me to say thank you and Beverly for all of your great work. Thank you.
I'll make sure she gets that to you. Have a great day.
Thank you, Dallas. Take care. Bye-bye.
Hello.
Hi, Representative Elliott. How are you?
Hold on. I'm not getting sound yet. I don't know why. And you can hear me, it looks like?
Yes.
Okay, hold on. I'm just gonna do speakerphone. I should be here. Can you talk now?
All right. How about now?
All right, there we
Closer?
go.
Excellent. I'm glad.
Cool.
All right. So we are missing your vote on 3 bills, I believe.
Well, there were four. Weren't there? There weren't 4 total. There were 3 total.
There were 4 total. But
I don't think I. Oh, did I vote on one of them? Maybe I voted on one of them. That's right.
I thought
Okay.
you
Okay.
were here for 5223.
Yep. Okay.
If you're not a yes, then we can change it. But I've got you down as a yes there. So
I'm Josh Elliott is a yes on all the bills today.
all right, I'll just read through them just for formality. We got HB 5201, HB 5313, and HB 5357 are the other ones. And I'll put you down as a yes for all of them.
Yes. 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 All right. Thank you so much.
All right, talk to you later.
Appreciate it. Take care.
Representative Scanlon, how are you?
Hey, how are you? Sorry, I'm cutting it close.
That's all right. You got just enough time, let's say. So we've got 4 bills for you. HB 5201, an act concerning public health concerns in the acquisition of water companies.
Yes.
All right. HB 5223, an act expanding the professional assistance program for regulated professions to include pharmacists.
Yes.
HB 5313, an act concerning registration of temporary nursing services agencies and maximum rates for temporary nursing services and nursing home facilities.
Yes.
All right. HB 5357, an act concerning mandatory overtime for nurses in hospitals.
Yes.
Okay, you're all set.
Thank you.
Hi there.
Representative
Oh, wait.
Henry, just make.
Thank you so much. I'm so sorry.
That's okay. So we got 4 bills here. We got HB 5201, an act concerning public health concerns in the acquisition of water companies.
Representative Linehan votes yes.
All right. HB 5223, an act expanding the professional assistance program for regulated professions to include pharmacists.
Rep Linehan votes yes.
Very good. HB 5313, an act concerning registration for temporary nursing services agencies and maximum rates for temporary nursing services, nursing home facilities.
Rep Linehan votes yes.
All right. HB 5357, an act concerning mandatory overtime for nurses in hospitals.
I would like to make a public statement that my vote today is in consideration of the fact that it will be worked on when it gets out of committee. So Rep Linehan votes yes.
Okay. And just under the wire you are in, we're all set. And now I have
Thank
to close
you.
the meeting. I'll talk